aren't reaching black communities. Sounds very similar to other health crises. Joining us right now is Tracie Gardner, Executive Director of the National Black Harm Reduction Network. Tracie, glad to have you here. And, you know, the point I was just making there is that, and I said for years that, man, that was one of the examples where racism actually helped black people. I mean, racist white doctors were turning black people away. Well, that then began to change. So when you talk about a lot of these, and then what then happened was, Tracie, we saw during the 2016, 2020 election, all of a sudden, white people were asking for compassion for people who had drug problems. They were demanding intervention. They were demanding counseling, demanding rehabilitation. I remember a lot of black people said, man, I wish we had that sort of empathy when black folks were dealing with crack cocaine. So we're still seeing, when you talk about the delivery of services to combat this, just like when it came to AIDS, when it came to other things, they're not reaching the black community in the same way.
And that's exactly the point. That's what we're talking about. These disparities continue and get especially noticeable or after health emergencies land, right? So National Black Harm Reduction Network, we're a fairly new organization, but the idea of black people needing to protect ourselves from systems is not a new idea, obviously. So we are joining Vital Strategies in a campaign that kicks off next week that's going to be called YouCanSaveLives.org. That's the website. And it's basically about getting more naloxone into our communities in a way that simply hasn't been done. It's going to be kicked off focusing on the 7 cities where the highest rates of overdose among black communities is happening: Louisville, Durham, Milwaukee, Albuquerque, Newark, and Detroit. And we are going to go all out, making sure that naloxone is just as available as an EpiPen. It's 40% of people who die of an overdose. There's usually someone around. And so this is a tool that has not been made available in our communities, and we are going to kick this off to make sure it is. It's a simple tool to save our own lives.
So what are you looking at? So are you trying to get policymakers to make changes so that resources are coming to black communities? What are you asking of the community? What are you asking people to do?
We are asking people to embrace this way that community can take care of itself. Again, what we talked about earlier, whether it was HIV or crack, but when we are armed with the tools, we can keep ourselves healthy. So this, again, is something that you just don't find in our communities in the way that it is in other communities. The overdose mortality rate, the overdose death rate has gone down in white communities and continues to either hold steady or increase in black communities. And yet and still, we don't have these tools. Now, some of the issue is about the infrastructure that we don't have in our communities because of the war on drugs. And that is not that long ago when you think about investments into our community. But this is something that doesn't have to be about the infrastructure. This is about a commitment to each other, that all of our lives are valuable, and that there's something we can do to save our loved ones with this simple tool.
Questions from the panel. Matt, you go first.
Okay, Tracie, I was reading in preparation for today that the number of overdoses has gone down, I think, in the last couple of years. But what I didn't see represented in that article was what percentage of overdoses in the last, let's say, 5 years have been black people and opioids, and how specifically this is affecting our community in those 7 cities that you mentioned. What do the numbers look like, number one, and what do they look like comparatively to the white numbers? And the reason I ask that is because one of the things that makes a lot of us bellyache, obviously, is that there was never any empathy or compassion for black people during, the height of the war on drugs, right? But now we're seeing this characterized in a different way. And I'd love to get your insight on how the numbers bear out and also what you're seeing from a policy perspective as it relates to the Black group of people who are affected in this way.
Okay, so it is true that the deaths, the opioid overdose deaths, have declined up to 24%. But that obscures what is going on in just about any Black community in this country, from New York to Detroit. And we chose, Vital Strategies and the network chose these cities because it's a disproportionate rate of deaths happening relative to the population of Black folks in these communities. And so we have always borne the brunt of emergencies, primarily because we have made emergency responses. We need to be alive, right? When fentanyl came into the system, this was starting to take out so many Black folks in ways that folks didn't even know. Older Black men wiped out from the introduction of fentanyl to the system, but there was no response there wasn't any response when it started happening to our elders, but then when it went into the white communities, there was a marshaling of efforts and a quick availability of these tools, whether it's naloxone, which a lot of people know as Narcan, test strips, treatment, all these ways that became from the empathy that was being felt for and by Black people or by white people. That did not happen for us, right? And there's been a lot of stigma. And the stigma in some parts is a little bit self-imposed, but it's also part of the whole campaign to make us be less than, to dehumanize, and to be absolutely unmindful of the challenges that we face. So in 22 out of the 25 states that we were looking at in a particular study from Georgetown, the rate of overdose death was higher for Black individuals than white through 2022 and 2023. Black men, 54 to 73, are 4 times more likely to die of overdose. Our young people are taking pills, drinking lean, and don't know that these are opiates, and they are at risk. And we need to be able to identify when someone's in an overdose and then be able to have those tools available. Next week, when we have our press conference, we're going to hear from a Black mom from Bowie, Maryland. Her name is Kimberly, and her son overdosed in the bedroom next to her home office. And she looked everywhere for the Narcan and couldn't find it. And it turned out tragically that it was in his pocket. We need to make sure that it's everywhere. It doesn't matter if you use drugs or not. It is about having a tool, just like an EpiPen, just like an AED, available to be able to stop a death.
Michael.
Tracie, in the article that you wrote, you talked about something that you just hit on, how some of these drugs aren't cast as opioids, and you talked about drugs popularized in hip hop culture, like Percocet and lean, aren't cast as opioids. Can you talk about how that makes it really challenging for what it is that you do? Trying to make more people aware of these life-saving medication and access to it. And also, are you getting any support from African-American celebrities, any support from the hip-hop community, et cetera?
Right. Okay, so let's be clear. Percocets, lean, those are opioids. And that is why we are seeing young people, older people, mixing it with alcohol. People are dying of overdose deaths, and sometimes people will be right around them and not know that they are dying from their overdose. They may think they're asleep or just, passed out. And so, to your question, there hasn't been a lot of engagement by Black leaders, Black electeds, Black celebrities. And, it would go a long way to helping dispel that the initial awareness of the overdose epidemic was portrayed as affecting white folks. This has not been the case all along. So the narrative of white overdose has obscured what has been going on in our Black communities. And the shame and the stigma make it difficult for folks to come forward and talk about it. That makes it difficult. We still have challenges getting connected to treatment, Medicaid, insurance, all of these things that are barriers to us getting care are happening while the numbers are going down in white communities. And so part of it is we don't have a champion, right? That's in part why the network got started, so we can elevate the folks who've been doing work, fighting HIV, fighting health epidemics in our community, but also to be able to try to identify a champion to take away the stigma of this. Look what Magic did with HIV. We do not have one single celebrity that you can mention that is associated, and there is no question in my mind that the viewers, people have lost folks to overdose. People have had family members and friends struggle with substance use, with addiction, and we can't pretend it doesn't happen to us. We have to take charge of it because we're not going to get any help from you know where. This is about organizing and mutual aid, and we have a simple way to do it.
Okay, thank you.
All right. Well, Tracie, if folks want to reach out to your organization, where do they go?
If they want to, they're going to go to youcansavelives.org. The press conference is on March 26th, but all the information is at that website. And, you know, again, we'd love the support for the National Black Harm Reduction Network. We're new, and we want to do for our folks what we know is needed.
All right. We'll surely appreciate it. Thanks a lot.
Thank you, Roland.